Hello, my name is Betty, and I want to thank you for joining me for another episode of Mental Health Matters. Today, we're going to discuss depression. What is depression? Depression, it's a common but serious mood disorder. It's also known as major depression, major depressive disorder, or clinical depression, and it causes severe symptoms that affect how a person feels, thinks, and how they handle daily activities such as sleeping, eating, or working. To be diagnosed with depression, the symptoms have to be present for at least 2 weeks. There are different types of depression, some of which develop due to specific circumstances. Major depression includes symptoms of depressed mood or loss of interest, most of the time for at least 2 weeks, and it interferes with your daily activities. Persistent depressive disorder consists of less severe symptoms of depression that last much longer, usually for at least 2 years. Perinatal depression is depression that occurs during pregnancy or after childbirth. Depression that begins during pregnancy is prenatal depression. And depression that begins after the baby is born is postpartum depression. Seasonal affective disorder is depression that comes and goes with the seasons. Symptoms typically start in late fall or early winter, and they end during the spring and summer. Depression with symptoms of psychosis is a severe form of depression in which a person experiences psychosis symptoms such as delusions or hallucinations. People with bipolar disorders also experience depressive episodes during which they feel sad, indifferent, or hopeless, combined with a very low activity level. But a person with bipolar also experiences manic episodes or unusually elevated moods in which they might feel very happy, irritable, or up with increased activity levels. Depression is a different form. It's very different from a regular mood change and irregular feelings about everyday life. It can affect all your aspects of life, including your relationships with family, your friends, and your community. It can result from or lead to problems at school or work. It can result from a whole lot of different reasons, and it can happen to anyone. But people who have lived through abuse or severe loss or other stressful events, they're more likely to experience depression. Women are more likely to have depression than men. An estimated 3.8% of the population, they experience depression, including 5% of adults and 5.7% of adults older than 60 years. Approximately 280 million people in the world have depression. Depression is about 50% more common among women than men worldwide. More than 10% of pregnant women and women who have just given birth experience depression. More than 700,000 people die due to suicide each year. During a depressive episode, a person experiences a depressed mood. They may feel a loss of pleasure or interest in activities. A depressive episode is different from irregular mood fluctuations. They last most of the day, nearly every day for at least 2 weeks. Other symptoms may include poor concentration, feelings of excessive guilt or low self-worth, hopelessness about the future, thoughts about dying or suicide, disrupted sleep changes, changes in appetite or weight, feeling very tired or low energy. Depression can cause difficulties in all aspects of life. A depressive episode can be categorized as mild, moderate, or severe, depending on the number and severity of symptoms as well as the impact on the individual's functioning. There are different patterns of depressive episodes, including single episode depressive disorder, meaning the person's first and only episode. Recurrent depressive disorder, it means the person has a history of at least 2 depressive episodes. Bipolar disorder, it means that the depressive episode alternates with moments of manic symptoms. which include euphoria or irritability, increased activity or energy, and other symptoms such as increased talkativeness, racing thoughts, increased self esteem, decreased need for sleep, distractibility, and impulsive, reckless behavior. Depression results from a couple of interactions of social, psychological, and biological factors. People who have gone through abuse or adverse life effects, they're more likely to develop depression. Depression can lead to more stress and dysfunctional and worsen the affected person's life. Depression is closely related to and affected by physical health. Many of the factors that influence depression, they are also known risk factors for diseases such as cardiovascular disease, cancer, diabetes, and respiratory diseases. In turn, people with these diseases may also find themselves experiencing depression due to the difficulties associated with managing their condition. Preventative programs have been shown to reduce depression. Effective community approaches to prevent depression, they include school-based programs to enhance a pattern of positive coping in children and adolescents. Interventions for parents or children with behavioral problems may reduce parental depressive symptoms, and it'll improve outcomes for their children. Exercise programs for older persons can also be effective in depression prevention. Everyone feels sad or low sometimes, but these feelings, they usually pass. Depression is different. It can cause severe symptoms that affect how a person feels, thinks, and handles daily activities, such as sleeping, eating, or working. And depression can affect anyone, regardless of their age, gender, race, ethnicity, their income, their culture, or education. Research suggests that genetic, biological, and environmental and psychological factors play in the disorder. Women are diagnosed with depression more often than men, but men can also be depressed. Because men may be less likely to recognize or talk about and seek help for their negative feelings and their depression symptoms, being undiagnosed and untreated is what this leads to. Studies have shown an increased risk for depression among the LGBTQ community. In addition, depression can occur along with other mental disorders or chronic illnesses. Depression can make these conditions worse and vice versa. Sometimes medication taken for an illness, it can cause side effects that can contribute to depression symptoms as well. Some other symptoms of depression feelings, it's like you feel on edge or increased anger or increased use of alcohol or drugs, isolation from family and friends, irritability, inability to meet responsibilities, or ignoring other important roles. Problems with sexual desire and performance can also occur as a symptom of depression. Not everyone who is depressed shows all of these symptoms. Some people experience only a few symptoms, while others experience many. Depression symptoms interfere with day-to-day functioning and cause significant distress for the person experiencing them. But to be diagnosed with depression, a person must have symptoms of a depressed mood or a loss of interest or pleasure in most activities. Children and adolescents, they may be irritable instead of sad, although several persistent symptoms, in addition to mood, are required to form a depression diagnosis. Depression, it can affect people differently depending on their age. Children, they may be anxious or cranky. They may tend to be sick or refuse to go to school. They may cling to a parent or worry that a parent may die. Older children and teens, they may get into trouble at school. They may sulk or be easily frustrated. They may feel restless or have low self-esteem. They may have other disorders such as anxiety or an eating disorder. They may have attention deficit hyperactivity disorder or substance use disorder. Older children and teens are also more likely to experience excessive sleepiness, called hypersomnia, and increased appetite, called hyperphagia. Young adults are more likely to be irritable, complain of weight gain, and hypersomnia, and have a negative view of life and the future. They often have other disorders such as generalized anxiety disorder, social phobia, panic disorder, or substance use disorder. Middle-aged adults, they may have more depressive episodes, decreased libido, middle-of-the-night insomnia, or early morning awakening. They often report stomach problems such as diarrhea or constipation. Older adults often feel sadness, grief, or other less obvious symptoms. They may report a lack of emotion rather than a depressed mood. Older adults are also more likely to have other medical conditions or pain, and that can cause or contribute to depression. Memory and thinking problems called pseudodementia may be prominent in severe cases. Depression can also look different in men versus women, such as the symptoms they show and the behaviors they use to cope with them. For instance, men, as well as women, may show symptoms other than sadness, instead seeming angry or irritable. For some people, symptoms manifest as physical problems. For example, a racing heart, tightened chest, chronic headaches, or digestive issues. Many men are more likely to seek healthcare provider about physical problems rather than emotional ones. While increased use of alcohol or drugs can be a sign of depression in any person, men are also more likely to use these substances as a coping strategy. There are effective treatments for depression. These include psychological treatment and medications. Seek care if you have symptoms of depression. Psychological treatments for depression can be combined with antidepressants in moderate and severe depression. Antidepressant medication, they are not needed for mild depression. Psychological treatment can teach new ways of thinking, coping, or relating to others. They may include talk therapy with professionals and supervised therapists. Talk therapy can happen in person or online. Psychological treatments for depression, they include behavioral activation, cognitive behavioral therapy, interpersonal psychotherapy, problem-solving therapy, and medication. Depression treatment typically involves psychotherapy, in person or virtual, medication, or both. If those treatments do not reduce symptoms sufficiently, brain stimulation therapy may be another option. Choosing the right treatment is based on a person's needs, preferences, and medical situation, and in consultation with a medical or healthcare professional. Finding the best treatment, it may take trial and error. For milder forms of depression, psychotherapy is often tried first, with medication added later. If the therapy alone does not produce a good response, people with moderate or severe depression usually are prescribed medication as part of the initial treatment plan. Talk therapy can help people with depression by teaching them new ways of thinking and behaving and helping them change healthy habits can contribute to less depression. Talk therapy, it occurs under the care of a licensed, trained mental health professional in one-on-one sessions or with others in a group setting. Psychotherapy can be effective when delivered in person or virtually via telehealth. A provider may support or supplement therapy using digital technology like apps or other tools. Evidence-based therapies to treat depression include cognitive behavioral therapy and interpersonal therapy, using other forms of psychotherapy such as psychodynamic therapy for a limited time, Cognitive behavioral also helps some people with depression. With cognitive behavioral, people learn to challenge and change unhelpful thoughts and behaviors to improve their depression and anxious feelings. Recent advances in CBT include adding mindfulness principles and specializing the therapy to target specific symptoms like insomnia. Interpersonal therapy focuses on life events that impact mood and vice versa. IPT aims to help people improve their communication skills within relationships, form social support networks, and develop realistic expectations to better deal with crises or other issues that may be contributing to worsening their depression. Antidepressants are medications commonly used to treat depression. They work by changing how the brain produces or uses certain chemicals involved in mood or stress. Antidepressants take time, usually 4 to 8 weeks, to work, and problems with sleep, appetite, and concentration often improve before mood lifts. Giving medication a chance to work, it's important before deciding whether it is right for you. Treatment-resistant depression occurs when a person doesn't get better after trying at least 2 types of antidepressants. One type of medication used to treat depression is esketamine. It is a medication that is approved by the FDA to treat resistant depression. It's delivered as a nasal spray in a doctor's office, clinic, or hospital. The medication acts rapidly, typically within a couple of hours, to reduce depression symptoms. People will usually continue to take an antidepressant pill to maintain the improvement in their symptoms. Another option for treatment-resistant depression is to combine an antidepressant with a different type of medication that may make it more effective, such as an antidepressant or anticonvulsant medication. All medication can have side effects. Talk to your healthcare provider before starting or stopping any medication. In some cases, children, teenagers, and young adults under 25 may experience an increase in suicidal thoughts or behavior when taking antidepressants. The FDA advises that patients of all ages taking antidepressants be watched closely. Brain stimulation therapy, it's an option when other treatments have not worked. This therapy involves activating or inhibiting the brain with electricity or magnetic waves. Although brain stimulation therapy is less frequently used than psychotherapy and medication, it can play an important role in treating depression in people who have not responded to other treatments. Brain stimulation therapy is sometimes used as an earlier treatment option when severe depression has become life-threatening, such as when a person has stopped eating or drinking or is at higher risk of suicide. The FDA, they have approved several types of brain stimulation therapy. The most used is electroconvulsive therapy and repetitive transcranial magnetic stimulation. Other brain stimulation therapies are newer and in some cases still considered experimental. The FDA has not approved any natural products for treating depression. Although research is ongoing and findings are inconsistent, some people that use natural products such as vitamin D and the herbal dietary supplement St. John's wort have stated that their depression symptoms have improved. However, these products can come with risk, including, in some cases, interactions with prescription medication. Do not use dietary supplements or natural products without first talking to a healthcare professional. Most people with depression benefit from mental health treatment. You should gradually start to feel better. Go easy on yourself during this time. Try to do things you used to enjoy doing. Even if you don't feel like doing them, they can improve your mood. Some other things that may help: Try to get physical activity. Just 30 minutes a day of walking can boost your mood. Try to maintain a regular bedtime and wake time, regular and healthy meals. Do what you can as you can. Decide what must get done and what can wait. Connect with people. Talk to people you trust about how you are feeling. Delay making important life decisions until you feel better. Discuss decisions with people who know you well. Avoid using alcohol, nicotine, or drugs, including medications not prescribed for you. New scientific evidence is telling us that chemical imbalances are not the whole story. There's a disconnect in how we think about depression and how we treat it. Researchers' understanding of what causes major depressive disorder is changing. Current depression treatments go a long way towards helping symptoms, but they may not help everyone. Antidepressants aim to balance the chemicals in the brain, like dopamine and serotonin, that help different parts of the brain communicate with each other. If the chemicals are properly balanced, they're able to regulate mood and emotions. Like we discussed, talk therapy is one treatment that may help people with depression. Talk therapy helps people with depression learn how to challenge their current thought process so that their brains learn and adapt to new ways of thinking. Despite treatment, some people with depression may not see results. In one study of people on antidepressants, 51% of people did not respond to the first antidepressant they tried. 72% of those people did not respond to the second treatment that they tried. In another study, 54% did not respond to talk therapy alone. Some people with depression are getting results from existing treatments, but not enough. For a long time, healthcare providers worked from research showing that depression is caused by a chemical imbalance. Antidepressants thought to work by targeting that imbalance. Talk therapy focuses more on the behavioral aspects of mental health. Some less common procedures activate the brain directly with electricity and magnetic field. But if new research is right and depression is more than just a chemical imbalance, then maybe it's time to look for additional approaches to help with symptoms. New areas of research are showing more causes of symptoms of depression. The hope is that the more that is known, the more treatments and approaches can be elevated. If depression is more than a chemical imbalance, what is it? New research is revealing that depression may also be caused by disruptions in neural networks. Our brains are made up of networks that help parts of our brain communicate. Neurons communicate with each other by both chemical and electrical systems. How the neural networks are connected, they can impact the way parts of the brain work together to respond to information and events. The coordination of these neural network connections can impact how we process and experience our world. Researchers are still learning more about how the networks in our brain work. You may have difficulty remembering past memories. You may lack the ability to focus. Increased anxiety, you avoid difficult situations or feelings. The network that causes negative thinking is when disconnects in one particular network causes the thinking part of the brain to be underactive. The thinking part of the brain has a hard time sending messages to the feeling part of the brain, which is more active than it should be. They are out of sync. When the feeling and thinking parts of the brain don't connect, negative thoughts can take over. And that's because the thinking part can't help the feeling part adjust and control emotions. This may cause repetitive negative thoughts. The disrupted connection between these parts of the brain mean that messages cannot be balanced. Significant potential morbidity and mortality contributing to suicide and adverse outcomes of medical illnesses and disruption in interpersonal relationships, substance abuse, and lost work time. These are all some of the factors of depression, but it is treatable illness, so don't ignore it. In addition, persistent ignorance and misconceptions of the disease by the public, including many health providers, as a personal weakness or failing that can be willed or wished away, leads to painful stigmatization and avoidance of the diagnosis by many of those infected. So, to stop the stigmatization, we have to stop. We have to get help. If you or someone you know is having symptoms, please get help or encourage them to. It is time to stop the stigmatization of mental health. Thank you again for joining me on this episode of Mental Health Matters.